what do you recommend as a treatment for no libido if you cannot get testosterone?
My book,
You are not
You're
broken.
Not Broken.
You are not broken.
Stop shitting all over your sex life. Libido's complicated. So the
Yeah,
first thing that you need when you have no libido is get educated about libido.
yeah.
Number one. And in that education, you will understand everything affects libido. And it's not just testosterone. It's not just estrogen. It's not just your age. It's not just, it's libido is incredibly complex. The other big myth about libido is that it should be spontaneous or you're broken. That's
Mm,
not true. And the other myth is that you shouldn't have to do anything to like get turned on or be sexual is like, yeah, absolutely you do. You got to warm up to be in the gym. You got to warm up to
right.
have an hour of sex. So we didn't get good adult sex education. So we believe everything Hollywood tells us, right? You
Yeah.
should just be hot and ready to go all the time. And you should want sex all the time. And nothing should affect that. And you're broken if you don't have that. That's what Hollywood tells us, right? Hollywood's wrong. That's a curated, planned story they're giving you. So the first thing you need when you have low libido is education about libido. And then you go from there. But I have saved marriages with this book. I've
Yeah.
actually ended a marriage with this book because somebody was like, I realized that I'm worthy of love,
Mm,
right? So
yeah.
the amount of education, we have this information now. It just doesn't trickle down and people feel horrifically broken. They don't understand libido, they don't understand sex, and they think the answer is just in a hormone, where it's like hormones are great. Hormones are great and they can be helpful. But if you just throw on a hormone and you don't have that education, you're not going to get the full benefit.
So, Dr. Casperson, then would you say that sort of the biggest barrier to preventing women from fully, I guess, enjoying their sexual wellness is lack of education about what that is?
Oh, yeah,
Yeah.
totally.
Yeah.
Women get educated and they get empowered and they're like, oh, sex is for me? I was raised to think sex was for somebody else. I
Right.
was doing it to keep somebody else happy. I was
Right.
having sex the way somebody else wanted to have sex.
Right.
They take this like advocacy, empowerment lens and they're like, first of all, what have I been doing?
Yeah. Yes, yes.
Second of all, why is society so shitty to women? Right? Like
Yeah.
you get some education and you're like, "Oh, this is rough. I've just been having sex the way somebody else has liked having sex my whole life." Right?
So,
And
Dr. Casperson, just before I turn back to questions, that I'm imagining you in your practice before you've written a book, before you had a podcast, the rumblings of advocacy happening. What was it? Was there a moment? Was there a collection of patients that came to you for help that kind of made you say, enough. I'm stepping into this and I'm gonna shake it up.
yeah, I mean my origin story was a patient I was very bonded with, right? Because it takes that. You can't be some stranger. I'm sure strangers change people's lives too, but like I was very bonded with this woman and she came in with a sexual health issue. And I didn't know how to help her. And so I was like handing her the box of Kleenex as she's crying. And in my head, I'm like, does anybody know? Does
Mm,
anybody know how to help these people? Like, because I was just told women are difficult and challenging. The
yeah,
gynecologists are taking care of them. So don't worry. Because remember, I'm a urologist, right? I'm
right.
not a gynecologist. But I'm like, we give Viagra to the dudes. 90% of men are heterosexual. So who's taking care of the people I'm giving Viagra to? Who's taking care of their partners?
Mm,
Right. And I really started learning to be like, well, I'm going to see if it's true that nobody knows anything. And it turns out we know a lot. It just doesn't trickle down, right? It doesn't even trickle down to the medical schools where the doctors are going to learn,
right.
let alone, somebody who doesn't know what a clitoris is, right? Because
Yeah.
but when my sex ed in 8th grade was like ovaries and uterus, that's how babies are made. Like we didn't learn about vulva or clitoris. Instagram doesn't even let us say our body parts. Like that's how messed up this is, that we're not
Mhm.
even allowed to say our body parts. So yeah, does education go a long way? 100%.